Hi, we're the Marysville FFA Vet Science Team. I'm Hadley Shoddy.
I'm Lindsay Dankenbring.
I'm Megan Skeen.
I'm Layla Chaudhry.
And I'm Grace Lubke.
Before we started this afternoon, we have all washed our hands with soap and water and freshly gloved up.
So our patient today has a twisted foot and a swollen ankle and has some obvious discomfort and pain. Our vet has prescribed Banamine injectable solution, which is used in horses to relieve colic, musculoskeletal disorders, and other general kinds of pain. So the label on the bottle says that we can inject Banamine either intramuscularly or intravenously. But today we're going to inject intravenously into the jugular vein.
We have consulted Dr. Dan Musil, and he suggested using a 20-gauge, inch-and-a-half long needle for the intravenous injection.
The dosage instructions on the bottle say to administer 1 cc of medicine per 100 pounds. Pellets weighing 1,100 pounds will require 11 cc's of medication.
I have prepared a label that we will be putting on the syringe for the injection. The label contains the Banamine solution, the number of milliliters that we're going to use for this injection, the date that we're going to inject the horse, the name of the horse, which is Pellets, and the vet's signature. I will be placing the label on the distal end of the syringe.
Now I will take a new alcohol wipe and clean the top of the vial with the wipe. The reason we do this is to make sure that we do not spread any infections or inject any bacteria into the animal.
Next, I will draw up the 11 cc's dosage for pellets. By putting 11 cc's of air into the syringe and then placing that into the bottle, it will make drawing this medication up much simpler. Once this is drawn up, I'll flick the top of the needle and slowly press the plunger to ensure all air is out of the needle and the syringe. Next, I'll cap the needle and remove it. And since the new needle will be placed into the vein of pebbles, I can throw this needle into the sharps container.
Now I will take a new alcohol wipe and wipe the injection site with it to prevent any bacteria from getting into the injection.
Once the injection site is prepared and someone is handling the horse for you, we'll take a new needle to insert into the horse's vein. This is again our 20-gauge, 1.5 inch needle. Now as Layla holds the head, I'll carefully go to the upper third of the neck, hold off the vein at the jugular furrow, and wait for the vein to distend or rise so that we can see it underneath the surface of the skin. Once this has happened, we'll carefully stick the horse in one quick motion. Now, as you stick the horse, you have to make sure not to hit the artery, which can be fatal if you inject the medication there. So the difference in between an arterial strike and a jugular injection would be that an artery would have pulsing blood flow and the jugular would have more of a blood stream. Luckily, we've had a stream and we can proceed with the injection.
Once the needle is correctly placed in the vein, I'll take the dosage and place the syringe into the needle. Be careful not to move the needle out of the vein. I'll next pull back slowly on the plunger and aspirate to make sure that we're still in the vein. This is shown by the blood flow into the syringe. Next, I'll slowly administer the medication. Pull out the needle and syringe in one swift motion. Cap the needle and remove it from the syringe and place it in the sharps container.
We will rub the injection site and hold it and praise pellets.
Good.
Pellets.
For our second procedure, we will be removing a bandage from Fido.
Now before we begin the procedure, we've got our surface cleaned and we are all wearing surgical gloves. But before we begin our procedure, we have to check with our veterinarian to make sure we have the correct patient, and today is the date that his bandage needs to be removed. But we've already got the go-ahead, so we're okay to begin the procedure.
Next, we need to collect our supplies. These consist of our bandage removal scissors. Now we can start.
When you begin to remove the bandage, you want to start at the proximal end of the dog. The proximal end is the end closest to the dog's body, and you want to cut from the proximal end to the distal end. The distal would be the end that is farthest away from the dog's body.
Okay, Now I will turn Fido over on his side for easier access to the bandage. I will take my scissors, open them up, and place the end flush with the dog's leg and under the layers of the bandage. I will now tip the edge of the scissors up, making sure that I have all of the layers of the bandage in between the scissors. I will then begin cutting.
As Lindsay starts cutting the bandage, I will help her remove the bandage layers away from the edge of the scissors. After she's finished, I will carefully remove the bandage and throw it away.
Once you're done removing the bandage, you need to notify your veterinarian.
Meanwhile, praise the patient.
Good Fido.
Finally, make sure your work area is clean, and thanks for watching our 2 procedures.